The best way to find out about clinical trials is to talk to your physician and your healthcare team. Often, physicians are aware of clinical trials that might be relevant to you, and often they are available at the center where you're being treated. However, sometimes clinical trials are only at certain locations around the country, or if your physician isn't aware of all the clinical trials, there are some additional resources. So one of the biggest databases for clinical trials is called clinicaltrials.gov. And you can go onto that website and you can search specifically for the condition that you have and find clinical trials that way. It is a little overwhelming and a little hard to navigate that trial as a non-medical professional, and even as a medical professional, to be honest with you. So there are some other options. For example, some of the patient advocacy groups offer cancer clinical trial navigators. One of them is the Leukemia and Lymphoma Society. So you can go onto their webpage and find the program and contact them, and they will have a nurse navigator help you find clinical trials that might be appropriate for you. Another example is the Sarcoma Foundation. They also offer a similar service where there's a nurse navigator that can help you find clinical trials that are appropriate for you. When you're considering participating in a clinical trial, there's a number of different things I recommend that you talk to your physician, your healthcare team, and the clinical trials team about. First of all, and most importantly, you want to know what are the potential benefits for you. In addition, you want to know the potential side effects. You should find out what your alternatives are. So it should be part of a discussion of all the possible treatments for you so that you're able to decide what makes most sense for you. With clinical trials, in addition to those questions, you want to find out if there are extra visits. Sometimes because you're on a clinical trial, we need to see people more frequently, and that would be important to know up front. You'd also like to know what is covered by your insurance, what isn't covered by the trial, and what out-of-pocket costs you might have. And then lastly, I think it's important to know if it's all going to be outpatient, if you need to be in the hospital, or if there's any additional procedures that are associated with it. When you're looking at a clinical trial and you're wondering if you may be eligible for it, it's important to know that for every clinical trial, there are very specific eligibility criteria and exclusion criteria. And what that means is that the clinical trial needs to be designed so that all the participants have certain similarities. So for example, age may be an inclusion criteria. The age could be 18 to 45, or it could be 18 to 70. Kidney function could be an eligibility or exclusion criteria, meaning most clinical trials will require you to have adequate kidney function, adequate liver function, a certain white blood cell count, a certain platelet count. So those are some of the things to look at. And when you're looking at the clinical trial protocol, or you're looking on clinicaltrials.gov, it will list all of the eligibility criteria, which are required for you to be eligible. And then also the exclusion criteria, meaning if you have any of those conditions, you are not going to be able to do that clinical trial. When we think about who should be enrolled in a clinical trial, we want to be as inclusive as possible. And so everybody potentially can be enrolled in a clinical trial. Some of the things that improve the chances of being in a clinical trial are good performance status. So in general, people need to be healthy enough to perform activities of daily living, which simply means being able to bathe yourself, being able to get dressed on your own, being able to feed yourself. So for a younger group of patients, that's generally the case. And so younger patients are generally always eligible for clinical trials. One of the things where we're really trying to increase enrollment, like one aspect in which we were trying to increase enrollment is diversity. So we see that a lot of clinical trials are not diverse, especially in terms of race. And those clinical trials then don't represent the general population that we're treating. So I think it's really important that we're increasing access to clinical trials.